Did you know that culture and language can shape your journey with chronic hives? Today, we're diving into the unique challenges Latinx patients face with chronic spontaneous urticaria. Allergist Dr. Juanita Mora joins us to share practical tips on breaking through barriers, getting the right diagnosis, and finding the care and support you deserve. This podcast is made in partnership with the Allergy and Asthma Network. We want to thank Novartis for sponsoring today's episode. While they support the show, all opinions are our own, and sponsorship doesn't influence our content or editorial decisions. Any mentions of brands is for informational purposes only and not an endorsement. Now let's get into it. You're listening to The Itch, a podcast exploring all things allergy, asthma, and immunology.
Today, we have another special guest, my friend from residency, actually. Juanita and I were at Rush University Hospital in Chicago. We both did med peds together. And so I'm super excited that Juanita is another allergist and so excited to have her on the podcast today. Juanita, can you introduce yourself to our audience?
Hi, yes, thank you for having me. Such an honor and pleasure to be here with you today. I'm an allergist and immunologist here in the city of Chicago. I treat a big inner city population, big melting pot Latino community, African American, kids and adults. I do a lot of advocacy work, which is where I think the meat of my work has been in my life, and I love what I do.
So today we're going to be talking about chronic spontaneous urticaria and specifically how it affects the Latinx population, which I know, like you mentioned, you treat and see, and obviously you are Latinas. So excited to really have this conversation and think about the nuances that are involved in different populations. Can you just tell us a little bit about what chronic spontaneous urticaria is?
Of course. So when patients come in and they say, I have hives, and the hives have been going on for more than 6 weeks, and they are intermittent and they come and go every 24 hours. And people say they're in my head, they're on my toes, everywhere. And no matter if they're taking any antihistamines like Benadryl, etc., they're not getting relief. So they come with this frustration of itching and feeling completely like they want to scratch their eyes out. And they're saying to us as allergists, help.
One thing that we do hear a lot about in the Latinx community is how chronic urticaria, chronic spontaneous urticaria, is a challenge to get diagnosed. Can we talk a little bit about why that might be?
Definitely. One thing that definitely presents a challenge is skin color, because the Latinx community comes in various colors, from very, very pale white to very, very dark skin as well, too. So initially, when doctors see this skin, they might not actually refer to it as hives. It might just be a contact dermatitis. It might be called just a rash. Maybe it's a viral rash. Maybe it's this, maybe it's that. So that's one challenge I definitely see. The other challenge I see as well too is the cultural beliefs in the Latinx community. So for example, many of them will come to me and say, I put alcohol on it to relieve the skin. I put vapor rub on it to relieve the skin. So people, the Latinx community coming in and seeking help is also a challenge, because many of them will try all the home remedies before they actually come to us. And they definitely go to their primary care providers first before they come to us as allergists. And then access to an allergist is the third barrier, because someone who speaks Spanish or knows the culture or has that cultural competency or intelligence is going to be also a hard find for patients.
So one thing I'd love to pick up on is just how it looks different in different skin tones. So can you describe a little bit about what that variation looks like for us?
Absolutely. So when we look at urticaria or hives on the skin, initially when it comes to, for example, pale skin, it'll look more pinkish rather than red as well too. And if you actually press on it, it becomes a white. So that's the hive, right? And when it comes to dark skin, unfortunately, you don't have that differentiation. Sometimes it's hard to tell that it's very red or pigmented there. It's also hard to blanch it out when we press it. So that's where the confusing part for a lot of physicians and clinical personnel basically presents a challenge for the Latinx community in diagnosing chronic urticaria.
And Juanita, I find that sometimes when patients take videos as opposed to just pictures, it can actually help with that differentiation. Videos pick up on texture differences, they pick up on color differentiation a little bit better. So that's one tip that I use for patients that have darker skin. What do you think?
I definitely love the idea. And yes, a lot of them will bring pictures and they'll just swipe with their phone and show you their torso full of hives when they had them, or their face. It's definitely a wonderful thing technology has brought us, right? Being able to take pictures and also being able to take video, just like you noticed, as well as definitely seeing the trend of the hives as well too, and for them to be good storytellers to us, because sometimes the Latinx community loves to go on tangents, so keep them focused.
That's really interesting that you guys like to see video, but what I've actually heard is that now that we can take videos, a lot of doctors don't have the time or don't want to watch the videos. So if you've only taken videos, they don't even look at the documentation you bring. Is this something that happens, and how can patients address that problem when they really just want to show what these hives look like?
Well, I think being respectful of the doctor's time too, and just showing short little clips. So it's not 5 minutes of the hives on the phone, but rather like a 1 minute or 30 seconds. So that way you can just see the nice pattern. What is the rash? Where's the distribution? Then you can go into the clinical history for any warning signs or anything else that you have to think about as a clinician.
Yeah, and I think the distinguishing thing that we're really looking for is the variation in color from one normal part of your skin to the area that's affected. And also, if it's bumpy, we want to be able to see that. So, those are the critical things that you want to be capturing on the video or the pictures that you're taking.
So, just a quick summary in case someone's listening to this and they're like, oh, okay, let me take a video next time. If I'm going to give them direction, right? I'm going to be their hive director. And it's, you want to take it at an angle where we can see the bumps and the variation. You can take the video if it's in multiple places of your body. And you also mentioned something called blanching, Dr. Mora, which I remember from our other episode, is where you press it and then you see a distinct color variation. And if that's possible to do that, to show that distinct color variation, would you also recommend a patient show you that on the video?
Yes, because it helps us differentiate from other rashes and other etiologies that this rash could be.
Great. And the last thing is keep it short and sweet, right? Like you don't need to take your doctor on a journey and create a documentary about your hives. Just show them what's going on with your body and you're golden.
Sounds perfect.
Yeah, and I just want to mention that we like videos and pictures because a lot of times when patients come into the office, they're not experiencing the rash that they are worried about or the hives that they're worried about. And so it's really important, instead of just using words to describe, that we do have some pictures so that we can really make sure that it truly is hives and not something else that might be affecting you. So just in general, we do like pictures and videos. And if your doctor is not open to that, then it might be time to find a new doctor.
Yeah, that's important. I think especially since we are talking about the Latinx community, to find a doctor who can speak to you culturally, but also, Dr. Mora, do you find that there are problems with language for a lot of your patients?
Yes, actually, I was at a health expo yesterday, and one of the things that I heard over and over from the Latinx community yesterday was a lot of them leaving an office where they might not have understood the directions because of the language or the cultural intelligence. Then basically what happens is they leave the office more confused than they went in. That's one big challenge that we have. So one of the things that we talked about is they said as soon as they see a doctor who speaks Spanish or at least can communicate in some manner, their anxiety level just drops. And we know that stress and anxiety can be a trigger for more hives to come out. So I can see where this plays in as well too. So I think that's important. And also in history taking, so that way we can get the whole story. Because one of the things that I want to bring out about the Latinx community is that a lot of them have blue collar jobs. So we also have to think about, does their job make their hives worse? So a lot of them are housekeepers or they work in maintenance. So they are being exposed to dog hair and cat hair. here. And so making their hives worse. They work in landscaping, they work in construction. So they come in and they're completely filled with hives. And when you ask the history, a lot of them, obviously, their work is making everything worse. The other place where I see it a lot is in bakers. So a lot of them have panaderias or the bakeries and using all this flour that also basically helps to trigger more hives if they have underlying chronic urticaria, and then they're exposed to these triggers that make it worse.
One of the things that I know are also available are translation services. How does the Latinx community feel about these resources?
I think the Latinx community is very appreciative of any effort that can be made to better communicate the information. They've told me about phone translation that they definitely appreciate. Now, a lot of patients do Google Translate. So the doctor talks right into the phone and then they read it, which is really nice. It's very helpful, especially in those who are technologically savvy. It's harder in our older population where they're not as technologically savvy. And then I know in practice settings, we also use a lot of medical assistants who might speak Spanish, or there's an actual interpreter in bigger settings like the hospitals, etc., hospital clinics, where there's established translator services that will definitely help to better the communication so there's more compliance and better clinical outcomes.
So this translation service is an amazing resource that apparently you can get. Do people know how to get these resources? Is this something that's very obvious, or is this something that you have to prepare before you go to the doctor?
Definitely, especially I've seen in my practice setting within the Latinx community, a lot of them for the phone translation, they have to have it already set up. So when they come into the clinic and then the person will connect and they will connect and they'll have a three-way. So that way the doctor will be in the conversation, the patient and the translator at the same time. So it does require a little bit of preparation time for it. And then sometimes people run late, appointments, etc., which cuts into the time that the translator might be available. So that's one small challenge, obviously, that can be faced then.
Yeah, so I think that the key thing is that patients should definitely call ahead, see if there's translation services available, see if their doctor speaks Spanish or somebody in the office speaks Spanish, especially if they are primary Spanish language speakers, because otherwise the visit might just be a total waste for them and they may not get the services that they need if they don't have translation services available in the office or if nobody speaks Spanish to help them.
And is this a service that's provided by your health insurance, or is this something that you have to pay out of pocket?
Depends on the insurance that people have. So some will definitely pay for translator services, and then some have to pay out of pocket to have the translator service. But I agree with Pyle. I think if you call ahead, hopefully a lot of the clinics will have its translation services already established. So that way they don't have to go ahead and do all this preparation as well too ahead of time.
Thank you. So that's an awesome resource to have when you go to the doctor. How about resources to take home? Because I feel like if you're looking for Spanish resources, and what we've heard from the patient population is that there aren't that many. How do you feel about that, Dr. Mora?
Well, I hope that we are creating more and more with more allergists who speak Spanish, so that way we can better service the Latinx community. But one of the things that I love to give them is Spanish handouts. So in my office, I have all the actual English handouts translated into Spanish. So that way they have something tangible to go home with, right? Because people absorb 10% of what you tell them in clinic initially. They're overwhelmed, they're frustrated, they're itchy, they're not feeling their best. And so fill all this information and you give them this plan, but now they have to execute it and they need to read up more on what they have. So I think giving them reading resources is always a good thing. And then it also basically blocks any myths that they might read on social media, such as TikTok or Facebook or Instagram, that tells them, oh, this is how you get rid of hives by doing X. I think giving them valid scientific information is so key. And I tell them to stop using Dr. Google.
Yeah. And Juanita, do you ever use resources from other countries, like Spanish speaking countries? Because I think it is a lot to have to translate things on your own as a clinic. So I'm just wondering if there's any resources that you use. I know there's the Allergy and Asthma Network has a lot of resources in Spanish, the American Academy of Allergy, Asthma, Immunology, the American College of Allergy, Asthma, Immunology also has sections that are dedicated to Spanish. But then I was even thinking, do you ever go to resources in Mexico or in Spain to get educational materials?
Absolutely. So I definitely use outside of the US other websites that are helpful for patients to print out information in Spanish. And these I use from Academy of Allergy in Mexico, Academy of Allergy in Spain. They have really amazing resources. And the one in Argentina is really great as well too. And they have resources on chronic spontaneous urticaria. They have it on asthma. They have it on different things as well too. So you don't have to reinvent the wheel. I completely agree. And these are valid resources. So then you don't have to worry about there being any false information on it, etc.
Great. And maybe we can link to some of those if we do have some doctors listening who want to access those resources. So we'll make sure to link those in our show notes because those are probably helpful for everyone, right?
Yes, absolutely. We'll be happy to.
So another thing we've heard a lot about is that the diagnosis process is long, but also getting the right treatments because not everyone gets offered all of the things that are available, like biologics, for instance. So can we talk a little bit about how that conversation goes? How do you give patients hope that these hives will eventually go away or calm down?
So what I tell them is their immune system is completely revved up. And I tell them their body is like an electrical cord. We're pouring bits of water on, like droplets of water. So it keeps sparking and sparking and sparking. I said, so my job as an allergist is to turn that little cord off and cool that body down and help them. So that way we completely turn this off. And I said, there's tools I have under my belt. First, we'll start with antihistamines if they haven't had good antihistamines to try it. And I tell them if this is not working, then I have medications called biologics that help block IgE that prevents the cells from making hives. And it really works very well. And it's a once a month injection. And it's something that I definitely use a lot in my patient population. So you give them hope by starting the conversation on what you know already and what's going on with them, and then reassuring them that there's other options for them as well too.
And do you think there are any barriers for the Latinx community in wanting to use injectables and biologics for something like a rash, something like chronic spontaneous urticaria? Or have you not really found a difference between general population and Latinx population in their fear of needles?
By the way, Latinx community loves injections, Pyle. So back in Spain, back in all the Latin American countries, they love using, for example, injections when they have, say, strep throat, they get a penicillin injection. When they have pain, they get a steroid injection, etc. So they believe a lot in injections. So when you tell them that there's an injection, especially like the middle-aged to the older population, they're completely on board with you. They're like, oh, injection? Let's fix it now. But you have to explain that it's not going to be an easy fix either. You know, it takes time for it to work. But there is also a certain part of the population that's a little scared on side effects of the possible medication as well, too, right? So what's going to happen to me if I take this injection, especially after the pandemic? There's been a little bit more skepticism on what injections can do to you, etc. So I think breaking down that barrier and explaining it always relieves that stress.
Great. I had no idea that injections are so popular. I think that you're right. They're used a lot as antibiotics, and even steroids and things like that are given frequently injectable in other countries. It makes sense that people might be more comfortable with injectables. But do you think that the Latinx community has access issues to biologics in general, though?
That's the problem. Yes, File. I think access is the hard part. One is getting referred to a specialist, and two, finding access to a specialist that's near you. So definitely as allergists, we're not many in the whole country. So then it's hard for them to sometimes find us, and they have to drive many hours. Many might not have the car. Allergists are usually not within the community either. So it's not like their little community center they can just walk to. Some are single moms. mommies, etc., where access to an allergist on a Monday through Friday schedule wouldn't work. They want weekend hours, etc. All these play definitely a role in them getting biologics. And then comes healthcare insurance, because a lot of the immigrant population as well too doesn't have health insurance. And sometimes they're on Medicaid or Medicare, and it's harder for us to get some of these medications through on those healthcare systems.
Are there access programs through the biologic companies that you've used that does help with access at all?
Yes, I have definitely used programs that are designed within pharmaceutical companies to help those patients who maybe lost insurance or have no insurance. So they have bridge programs, or they have funding programs as well to help provide free drug for these patients. And that's one thing I'm very thankful that I can do for my patient population, especially when they have no insurance and these biologics do cost a lot of money.
So there is hope out there for patients if they feel like, antihistamines aren't working. I've tried all the other home remedies, and since injections, and I totally get that. It's like you feel like something's gonna work, when something gets injected in you, it feels like it's actually working. So they know that there is an option. If you're told no, don't take it as the only answer. You can potentially pursue further routes to get you that medication. Is that what I'm hearing?
That is correct. Definitely seek more help. There is hope out there. Seek the care of an allergist near you. Ask for translation services. Get to the right person so that you can get the help that you need and relief of the symptoms that you have. Because I feel that a lot of people then fall a little bit into depression as well, to which we haven't touched on yet, especially having had chronic spontaneous urticaria for a long time and not getting any relief. And I think this podcast is bringing a lot of light and hope to a lot of people.
Yeah. So what you're talking about, Juanita, is so important to remember that chronic spontaneous urticaria is not a life-threatening illness, but it actually affects quality of life in a big way for our patients. And that's these stories that we really have to sometimes pull out of the patient. And that's another message that I always give when we're talking about chronic spontaneous urticaria, is that we really need the patient to tell us what's happening, how it's affecting their lives, sleep, work, and all of these things. Do you think that that's different for the Latinx community? And does it play a role in even their family life and how they're explaining it to their doctor and how comfortable they are coming out with this condition and talking about it?
Excellent question. So in the Latinx community, one thing I find is women will tell you everything, right? Women will come into the office and tell you this rash has been going on this long, etc. They'll have pictures. Men will only come in, one, when they're at their wits' end, or two, their wives bring them in, because so many of them have had a lot of this going on, but they might be embarrassed of their symptoms, think that it's contagious. And also sometimes they're just in a mental state where they're like, this is never going to get better. And they feel really down. They're not sleeping. They're anxious, which is making the hives go even more wired in their body. And so it's breaking down those barriers. And I always start the conversation when I see the man come in with his wife. It's like, don't worry. She loves you so much. She brought you in because she wants to help you. And so that usually breaks down a little bit of that anxiety. And then we start talking and really relieving that information. But yes, it's that fear that I see a lot.
So I also think this condition is often misunderstood. And we also hear is that families might think that the person's exaggerating and that the condition isn't really serious. Have you seen that in your patients and had people talk to you about that? Do you think it's more common in the Latinx community?
Well, research definitely shows that chronic spontaneous urticaria is more common in the Latinx community and in women. So there is definitely a higher prevalence. And I think there is a lot of barriers within the family and different cultural aspects that sometimes play a role in, one, a delay in diagnosis, two, a delay in treatment as well, too, and three, admitting that there is this rash. One is fear hear people not wanting to go out with this rash or be seen. So they are wearing long sleeves, pants, and definitely their whole body is covered because they fear that people are going to think that they have a contagious disease. There's patients I have who said, oh, I won't go to church because if someone sees me with this rash, I thought they would say something that, I'm contagious and this is really bad. No one would want to sit next to me. So I was going into their mind and really thinking, wow, this is a real concern for them. People who don't want to go to the beach or take off their shirts or go into a bathing suit as well in the summer because they're full of hives and they're just embarrassed. And then within the family, sometimes people don't want to admit that there's a problem. And so they're like, it's nothing. Don't worry about it. Why are you going to go to the doctor? Why are you going to spend money? All they're going to give you is Benadryl because this is what they've searched online. And so it's really breaking down the barriers. And I'm so happy we're doing this podcast because we're exploring so many things on many levels in the Latinx community that I think will open up their minds on getting help for this.
Absolutely. We don't want people to feel isolated. And I know that we've talked about support groups. There's online support groups. The Allergy and Asthma Network have patient stories that people provide can also help make you feel less alone and less isolated. So I think it's really important to remember that there are other people. There's many other people with this condition and that you're not alone and that there are treatment options and things that we can do to help you beyond Benadryl. And actually, we don't even like Benadryl anymore as allergists because of all the negative side effects. So there are other medications. And Juanita, thank you so much for taking the time out of your busy Sunday to be on with us today. What last suggestions do you have for your Latinx community and chronic spontaneous urticaria?
Well, my take-home points from today's lovely conversation with both of you is that Latinx community, please don't be afraid to seek help. There's hope for chronic spontaneous urticaria. There's a lot of resources. There's a lot of support. There's wonderful treatments. So that way we can get you back to doing what you love the most and having the best quality of life. Seek for an allergist, seek translation services because we're there to help you. And I hope that we really have provided a lot of wonderful information for you to really get good relief of your symptoms.
Amazing. Thank you so much. I love hearing that there's hope and that, like I said before, don't take the first no because there's so much nowadays and there are so many resources out there which we will link to hopefully help you both share with your family and guide you on your journey.
Yeah, thank you so much. Thank you for listening to today's episode. Remember that all information you hear today is for informational purposes only and are not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider. And also, don't forget to subscribe to our podcast. And if you have a second, help spread the word by rating our podcast and sharing with your friends and family who might also be interested in learning more about allergies, asthma, and immunology. You can always stay up to date by checking out our Instagram, The Itch Podcast, where you can leave questions you are itching to know, or check out our website, which is www.itchpodcast.com, which contains more information about the subjects we covered in today's episode and every episode. Until next time, have a fabulous week.